So let's talk a little bit about some new evidence that has come in on psychedelic drugs. Now, let me state my bias up front. I'm not a fan of psychedelic substances, hallucinogenic substances. I think I'm one of those people where whatever my body chemistry is, it's the category of drug I like the least. I have no problem regulating my mood so I go up or I go down. I have many problems with, seeing Scooby-Doo in my living room and totally changing my consciousness and my perspective in a way that's radically different from what I currently feel, because I kind of like how I feel on a regular basis. I don't want to go to like Neptune in my mind and then, what if I can never come back from Neptune, or what if it totally alters my, daily mind, which again, I like. So it's not for me, right? But for me to say it's not for me just means it's not for me. That doesn't mean it's not for others. There are plenty of other people who get phenomenal benefits from psychedelics, and I never take that away from anybody else, right? So anyway, this is an Axios. Psychedelics with psychotherapy helped heavy drinkers cut back, study finds. Now, this is particularly noteworthy because we've sort of been stuck in a rut when it comes to how to fight addiction. There's still people who cling to, and if it works, hey, God bless them, but some people cling to, the 12-step programs or whatever, and some of them have religious underpinnings. Well, what if you're not a religious person, right? And by the way, the success rate of those programs is under 10%. Now, again, if you're one of the, 7%, 8% that get help by it, God bless you. I love you and keep doing it. But if you're one of the people who it doesn't help, well, you need something else, right? The key ingredient in magic mushrooms combined with psychotherapy resulted in robust decreases in heavy drinking by adults diagnosed with alcohol dependence, according to a study published in JAMA Psychiatry. That's the Journal of American Medical Association, I believe. Psychiatry. It's a promising development for the understanding and treatment of alcohol abuse, which has few effective medication options, as well as addiction more generally. Now, I will say there is a pill that people take if they're really desperate and they're alcoholic. There's a pill that you could take where anytime you drink alcoholic drink, you start throwing up. And I know some people who've taken that and it's been successful because it provides a disincentive for you to drink. You start to have that negative association where every time I drink alcohol, I throw up. And so that works for some people, but maybe some people don't want the negative feedback. They'd like a more positive approach to this. The first published randomized trial to examine the effects of psilocybin in addiction and surpass any previously published study of the naturally occurring psychedelic drug, said Charles Marmor, chairman of NYU's Langone's Psychiatry Department, which led the study. It's a major breakthrough, Marmor said. There is an urgent need for novel medications for alcohol use, for addiction generally, and more broadly for the entire field of psychiatry. MDMA, psilocybin, and LSD, combined with psychotherapy, are being explored for treating a range of addictions and mental health disorders, including treatment-resistant depression and PTSD. There's also been some promising stuff on that front as well that we've covered on this show. This double-blind trial, led by the researchers at NYU Langone, compared the effectiveness of 12 weeks of psychotherapy delivered with 2-day-long medication sessions of either psilocybin or an active placebo. The study included 95 adults aged 25 to 65 years old who had been diagnosed with alcohol dependence and had at least 4 heavy drinking days during the 30 days prior to screening, but were not currently receiving treatment. The percentage of heavy drinking days during a 7-month period was 10% for the group that received psilocybin compared to 24% in the placebo group. The consumption of drinks per day was also lower in the psilocybin group. Wow. Those are some pretty solid numbers, if you ask me. So it looks like the psychotherapy helps either way, but it helps more if it's guided by psychedelics. There were no serious adverse events among participants who received psilocybin. Researchers aren't exactly sure why this works, but they say it appears to offer more durable outcomes by treating the underlying disorder in the brain rather than merely the symptoms of the disease. I'd say it saved my life, said John Costas, a patient who suffered from alcohol dependence for years and failed multiple treatments. He said he was initially terrified to use psilocybin. Quote, I stopped drinking after my first psilocybin session. It worked that quickly for me, he said. Wow. The treatment is still several years away from possible FDA approval. Doctors said they are planning a multi-state clinical trial with more than 200 participants and 15 sites, which is expected to take at least 2 to 3 years. Quote, this is part of a really burgeoning program of research, which we hope will offer relief from pain and suffering from a broad variety of patients suffering from psychiatric illness and addiction, Marmor said. So look, this is amazing. So it's sort of, one of the theories that I read around this, and this is not from an expert, but it's this idea that it breaks your pattern of thinking. So it really sort of upends your consciousness in a way that's almost like hitting the reset button on your consciousness. And that allows people to break away from old habits, and especially old habits that are dangerous. And I mean, look, it's amazing. These are amazing results. I think the more they study it, the more they will verify this. And I don't just think it's psilocybin. I do think it's LSD. I think it's a variety of the hallucinogenic substances. They just affect people in that kind of a way. Now, the other thing that's amazing about these substances is that they're not physically addictive. Like most other drugs, whether they're uppers or downers or what have you, they are physically addictive to one extent or another, even if it's just mentally addictive. But these are not like that. It's almost like you have one transformative experience and then you can move on. And look, it's about damn time we started studying stuff that wasn't the same old bullshit. It's about time we broke free from this just say no anti-drug mentality that swept the country. It's good to see this evolution. Again, they're going to study it more, and I think they're going to verify these results. And there's going to come a day where you can be prescribed this stuff for PTSD or depression or alcoholism or whatever. And look, in my ideal world, there can come a day where you go to your local pharmacy and you can grab some magic mushrooms or whatever. I think that if we actually want to say we believe in liberty and freedom, well, that's part and parcel of that. And really, I see almost only upsides to this sort of stuff. So it's wonderful news. And so there is hope out there, not just for people dealing with alcoholism, but again, also people with depression, with PTSD, with severe anxiety. I think there's been some promising early results on all of those fronts. So it's a great thing to see. All right, guys, that is the show for the day. I love y'all. Thanks so much for listening to me babble on a daily basis. I really appreciate you. By the way, for anybody listening on YouTube, remember, if you're more of a podcast person, you can now get this show on Spotify and on other podcasting platforms, and it's the full daily shows. So if you're more of a podcast listener, you can ditch the YouTube videos and go over to the podcasting outlets also, or you can just watch both. I'd appreciate it if you watch both. That's great for me if you watch both. So there's that. And then again, thanks to everybody who is a Patreon supporter of this show. You guys mean the world, and you guys make this show work. Usually the link to the Patreon, if you want to support the show, is in the video description box of all the videos. And again, thanks to the Crystal Kyle and Friends subscribers on Substack. We love you guys as well. You guys mean the world to us. Remember, you get the videos of the Crystal Kyle and Friends shows a day before if you join up on Substack, and then everybody else can listen for free, but it's just the audio version of the podcast for Crystal Kyle and Friends. So anyway, yet again, I love you guys. Everybody have a great rest of your day, and I'll talk to you soon. If you want to see me and Crystal Ball interview legends like Noam Chomsky, Cornel West, and more, subscribe to Crystal Kyle and Friends on Substack. $5 a month gets you the video version a day early. Remember, we take 0 ad dollars for this podcast. Or you can sign up on Substack for free and get the audio version a day later. Link in the video description box below.